Welcome to Pharmacy View Podcast, where we provide regular interviews with pharmacists and key people within Australian pharmacy and the associated global industry. In this stream of podcast episodes titled RX to Riches, we delve into the evolving global pharmacy landscape, exploring the challenges and opportunities, and examining the current state of retail pharmacy across the globe. With each guest, we discuss the hurdles they face and the potential growth areas that may shape a brighter future for your pharmacy or industry-related business. I'm your host, Michael Alexander, pharmacist, digital health enthusiast, and co-founder of Audirie, an AI-powered communication intelligence platform serving the healthcare industry across the globe. My guest today is proudly brought to you by Shopfront Solutions for all your shelf and digital marketing needs, part of the Arion Technologies Group.
The approach we take is obviously the greatest number of resources are in Australia, and we support the organisation globally. We've got models that work in Australia, and we've got the template, so to speak. But it's really, really important that you overlay both the regulatory aspects of the local environment and those cultural aspects, and really look at the workforce and what they need. And so we've got teams locally that do that. So as an example, when we rolled out New Zealand, we provided them our intern training program. Initially, they used that, but then they have evolved that so that they can actually meet those local needs. An example is the way our Australia has their registration exams is very, very different to what New Zealand does. So New Zealand has an OSCE style exam with lots of scenarios, whereas Australia has an exam that has got 3 parts. You're face to face with two examiners, and it's a combination of role plays and a discussion with your peers. And so you have to evolve.
Welcome to the RX to Riches podcast. My guest today is Angela Stathopoulos, the Group Manager of Education and Development at Chemist Warehouse. With over a decade of leadership in pharmacy education, Angela oversees the training programs across the Chemist Warehouse and My Chemist networks. Her career spans significant roles, including Director of Pharmacy at the Royal Victorian Eye and Ear Hospital and consultant at PharmConsult, where she advised on pharmacy services and medication management for a wide range of healthcare facilities and professional organizations. Angela has also served as a sessional lecturer at La Trobe University, focusing on ophthalmic pharmacology. She holds a Bachelor of Pharmacy degree from Monash University and a professional certificate in health systems management from the University of Melbourne. Welcome, Angela.
Thank you for having me, Mike.
It's a pleasure. Now, I gave a little bit of background as to your the years of professional service in the pharmacy industry, but can you share a bit about your journey before and during Chemist Warehouse, and what inspired you to focus on training the next generation of pharmacy professionals?
Sure. So you made me sound young, but I'm not that young, Mike. I've actually been a registered pharmacist in Australia for 28 years, and my career has spanned probably nearly every part of the pharmacy industry. So community, regulatory, and hospital, both public and private. And so I've been very, very fortunate that I've seen a lot of different aspects of pharmacy. And in all of those roles that I have had, I've always had students and interns, and it's been a passion of mine to actually nurture the next generation. So when the opportunity arose to join the Chemist Warehouse group in this particular role, I jumped at it because I thought Chemist Warehouse is big enough that I can make a real difference to the way pharmacy gets practiced in this country. And 7.5 years on, I'm still here, which is the longest role I've held in my career.
Well, what's your favorite part about the role?
Look, no one day is the same because it's education and development. I'm also really, really fortunate in that I get pulled into a lot of different projects that allow me to focus on development of different professional services. And so I've been involved in the rollout of aged care, I've been enrolled in the rollout of vaccination services, and currently I'm involved in a project for hospital pharmacy. So the organisation is looking at expanding its service offering into private hospitals, and because of my background, I've been involved in that. So whilst education is the core part of my role, I get drawn into a million different things, and so that's what I find exciting. And my one piece of advice to pharmacists is don't say no. Take opportunities as they arise, and that in itself creates more opportunities for you to advance.
I love that. I want to ask you what your least favorite part of the role is yet. Let's get into the conversation, and I might be able to circle back with that. But I,
Sure.
I wanted to ask a little bit about Chemist Warehouse.
Mhm.
Is known as an innovative brand. You guys are working on new things all the time. You're expanding overseas. We'll talk a little bit about that. But in terms of education and training, can you tell me a little about some of those programs that Chemist Warehouse offers their pharmacy team members, right?
Yep.
And also how has that training evolved over the years to keep up with a changing landscape of pharmacy practice?
Well, since I came on board, there's now a dedicated team that looks at this particular aspect for the business. And so when I came on board, we were doing we were delivering our intern training program, and that's a training program that's been developed over about 45 years. And it's not a set and forget, because it's really, really important to understand that the industry is ever evolving, and our educational offerings need to evolve with the pharmacy profession. And so even amongst the intern training program, and we do run the biggest intern training program in the country. It's not an accredited intern training program, but this is something we offer above and beyond for our interns. And so what happens is they still do the bulk of their learning at the cold face, at their supervised practice site with their dedicated preceptor. They still have to do an accredited intern training program, and this is something we offer over and above. So it supplements their learning in store and also provides them exposure to things they might not necessarily be exposed to. But that's only one of the programs we have developed over the time that I've been here. So we've always been very, very strong in delivering S2 and S3 training, because that's mandatory training that we require for the accreditation of our pharmacies. And we've always looked at enrolling people into certificate 3s and 4s in community pharmacy. And we do that in collaboration with our education partner, which is the PSA. But we have developed a whole lot more programs internally. So some of the ones that we're really proud of is our Pharmacist education program, where we provide CPD accredited training that is on demand, that pharmacists can actually choose to do in their own time on any device. So that could be phone, tablet, or PC, and it's available to them for at any time, which means they can actually do that at a time that suits them in a way that suits them. We've also developed a Leading for the Future program, which is our leadership program for current and emerging leaders, and it's in year 3 of the program. And so this is a program that we develop at 2 levels: a fundamentals level for the lower management type roles, and the advanced level for our owners and senior managers. And so what happens with that particular program, it's 4 whole day workshops, and we developed it internally with a consultant, and we facilitate it internally as well, with some assistance by external consultants. And so the core themes of the Leading for the Future program is leading self, leading team, and leading service. And so it really, really touches on the elements of our business that are important, and we tailor it to the needs of our business. And so that's a program that we're really, really proud of. We've just piloted our new Step Up program, which is our student pharmacist education program, which is really, really designed to to give students the tools to become effective team members in the pharmacy and really give them a platform to step up into their pharmacy career as well. So this is an example of where we thought we knew what they wanted, but the reality is we didn't. And so we developed a stakeholder consultation group of students, management, and owners so that we can understand what the gaps were. And we've tailored the program to actually meet the needs of both our learners and the business. And so we've had really, really good feedback from the pilot, and we're looking at launching that across the country early in 2025. We're also finalising our new retail manager program and our new managing partner program. So that is to support people that are early in their journey of ownership with the group, and so they actually have all of the fundamentals that they may not have learnt along the way in their journey. And it's almost like a band-aid, because the next piece that we're going to focus on next year is an early career pharmacist program that looks at the ownership, management and ownership pathway, and then some of the more clinical pathways within our business. And then the retail manager program is important because the retail manager supports both the managing partner and the pharmacist in charge to actually run the day-to-day operations of that front of shop. So that's super important as well. And it's a mechanism by which we can standardise the offering across the country. And some of those programs are a combination, a hybrid of face-to-face workshops and online. Some of them are purely online. So it really just depends on the audiences and the needs for those audiences.
I mean, that is a lot of training.
It's a
when
lot of training. Yep.
when you say it like that. And I just want to maybe circle back to the intern training in particular, because there might be potentially a stigma in the profession amongst intern students that think, well, if I go to Chemist Warehouse, I'm not going to get a lot of training. Right? I'll be too busy just doing prescriptions and serving customers. But what you relate to, it's actually the opposite. You are leveraging technology to deliver training. You're leveraging in-person training. You're doing management training. You're doing managing partner training. You're building stakeholder panels to advise you on the best way to do the training. So it is a very, very robust training program. I'm just wondering whether do you feel there is a stigma that you're trying to overcome in the industry and get the word out that we actually have many, many programs for interns and students that come in and want to learn.
Yep. So, Mike, look, I think the industry knows that we provide a really, really robust intern training program, and it is a draw card across the industry. The reality is we were probably the first to do it in the community pharmacy space, but now other banner groups are starting to do it. So, whilst we're not letting go of our intern training program. In fact, we're forever evolving and improving it. It's important that we've actually got the other programs to support people no matter where they are in their journey. In terms of us being busy, yes, we are. But we're also appropriately resourced for that busyness. And in all honesty, I actually think it's an opportunity, because the busier you are, the more you're exposed to everything that community pharmacy has to throw at you. And so it's really about leveraging every single opportunity and using it as a learning experience.
I think it's a great point, and I'm actually sitting here feeling a little jealous, thinking back to my intern experience, which was very much not focused on training me to be the best pharmacist, but more about me just filling prescriptions as quickly as I could. I was not working at a Chemist Warehouse. I was pre-Chemist Warehouse to age myself. So I think that to be able to give those sorts of opportunities, and now we're talking about interns, but to all pharmacy staff, whether it's pharmacy assistants or retail managers or pharmacists, I think is extraordinary and really, really something that the profession needs to embrace if we're going to evolve to the next stage of our development as pharmacists and as pharmacy professionals.
Yeah, agree completely. Absolutely.
Yeah, well, let's talk a little bit about technology because we mentioned that as a way you are deploying training for pharmacists, pharmacy assistants, etc. What tech tools do you think might be game changers for training in pharmacy? What are you using at the moment, and what are you hoping to use in the future to supercharge that evolution that we're talking about in pharmacy training?
Mike, the reality is COVID made us look at the world in a different way. And there's no doubt that in the pharmacy profession and in education more broadly, in the last 5 years, I've seen lots and lots of change. So, where we used to provide all of our training face to face, that's no longer our reality. And so, even with our intern program, we had to pivot during COVID to an online platform. And so, we were delivering our training using Zoom. And now we've actually morphed into a hybrid where we actually do a combination of face to face because it's important to actually connect with people. But then we also do a whole lot on online. And so people can do it from anywhere in the country and get a consistent environment. And the fact that we are a federated country and we run a program nationally, but we do have state teams that actually tweak it to the local levels. Or local environment. And that's what we do for some of the other countries that we're in as well. And so we've got a core and then it's tweaked. But as an example, for our online webinars for our intern program, we actually deliver them nationally and then we break up into workshops that are delivered locally in smaller groups. And we can do that online. The resources required to deliver online is a lot less. But it also means I can reach people in Mildura, which are 5.5 hours from Melbourne, because it's unrealistic to have them come to Melbourne for an intern training day. And even when we do have our face-to-face, we do offer up the ability to dial in for some of the sites that are just way too far to be able to come there face-to-face. The other piece is we're seeing the evolution of AI, and definitely in our pharmacy assistant training, that is something that the PSA is rolling out, and we've undertaken a trial. And we've had some really, really good feedback. Again, consistent machine learning. And then there's a level of oversight where you audit the results. And so I think there is a level of skepticism when it comes to AI and machine learning, that maybe it's learning the wrong thing. So I think it's only as good as the information you put in and the auditing processes around the rigor to ensure that it continues to deliver the objectives that we're trying to deliver. And I know the PSA is rolling that out also in their aged care training, so their on-site pharmacist training for aged care, and they're looking to roll that out also for their prescribing training, which means that rather than having to find a site where you do supervised training, you can have a consistent approach to assessment from the comfort of your own site or your own home.
Absolutely. And I think you really said something that resonated with me and something that we always have to keep in the back of our minds with regards to AI, and we hear obviously a lot about it, is it's a tool that we can use to standardize approaches, to increase our reach to various learners, no matter where they are across the globe. But it's just a tool, and it's only as good as the people who wield the tool, right? And it's not a be all and end all. It's not a panacea and just a solution in itself, right? It's a means to an end. As long as we use any type of technology that way, I think we're going to get better results. Would you agree?
I completely agree, Mike.
Absolutely. And I think one of the benefits to technology, as we said before, is increasing the reach and scope of what we can do. And I wanted to then kind of segue into, because you mentioned this, the fact that Chemist Warehouse is operating across multiple countries. I think you just opened your first store in Dubai. Is that correct?
Correct. That's
Yeah,
correct. With a second one on the cards before Christmas.
which is amazing. You're already in a number of countries. I think it was New Zealand, Ireland, I believe. So you obviously have a huge geographic reach, and I wanted to talk about that through the lens of training because each country has its own regulatory and cultural differences. Obviously, United Arab Emirates is very different from Ireland, for example. So, what are your biggest challenges in standardizing that training? How do you tailor programs to meet local needs, but at the same time meet that consistent or maintain that consistent standard of education across all chemist warehouses?
Look, I mean, I'll talk about the New Zealand situation and then the Irish situation. In terms of UAE, we're in our infancy, so we haven't quite gotten there. But the approach we take is obviously the greatest number of resources are in Australia, and we support the organisation globally. We've got models that work in Australia, and we've got the template, so to speak. But it's really, really important that you overlay both the regulatory aspects of the local environment and those cultural aspects, and really look at the workforce and what they need. And so we've got teams locally that do that. So, as an example, when we rolled out New Zealand, we provided them our intern training program. Initially, they used that, but then they have evolved that so that they can actually meet those local needs. An example is the way our Australia has their registration exams is very, very different to what New Zealand does. So New Zealand has an OSCE style exam with lots of scenarios, whereas Australia has an exam that has got three parts. You're face to face with two examiners, and it's a combination of role plays and a discussion with your peers. And so you have to evolve. Now, the reality is the three countries in Australia, New Zealand, and Ireland have got similar healthcare settings. They're all English speaking, a similar healthcare environment, and so we're lucky. Now, the UAE is very different. So we're going to have to engage with local people that are experts in their field to make sure that we deliver what is required in that setting. But even in Australia, we've got a federated country where the health portfolio sits with the state, which means we've got different legislation and regulations in every state and territory. So just in Australia alone, you have to think about those local nuances, and we rely on the experts in those jurisdictions to tell us what the requirements are so we can tailor. And we can't do a national program with Victorian legislation because it just doesn't fit the bill. And so you have to think about that in the delivery of your training. So, do you deliver the things that are consistent across the jurisdictions, and then let the state teams take those nuances, or do you just allow the state teams to deliver all of that?
I think that is a challenge, I have to say, because not only, as you said, there are differences in each country, there's differences in each state. So there is a lot of regulatory nuances, I guess would be the word, that you need to prepare for, understand, lean on expert advice, make sure you're absorbing that advice, putting that into the curriculum, and then after you deploy it to learners, you need feedback, right? You need to understand how well is it working, and are they learning what we want them to learn. So talk to me a little bit about that feedback mechanism. How do you know that the learning is effective, and that if whether we're talking about New South Wales or Ireland, whether your learners are actually absorbing the content?
Well, I think that, like, you nailed it. Feedback is super important. And so we have mechanisms by which, for each particular part of the training, they can provide feedback on their satisfaction, what hit the mark, what was missing, what they thought of various presenters. And then at the end of the program, we actually do a more holistic survey of both the learners, the preceptors, and business owners to make sure we're hitting the mark. That information gets stratified, it gets looked at nationally, but also gets stratified into each jurisdiction. And then we provide that information back to those states as well. Then we have evaluation, like program evaluation meetings with each of the jurisdictions. And then we decide, well, what things do we need to change and improve on? And I'm very, very lucky. I've got a team that does all of that, and then they will present their findings to me, and I'm the one that then is the final decision maker. So I've got a meeting with respect to that for our intern training program in Australia tomorrow, because we're at the end of the program and we're planning for next year. Now, my brief to the people that are going to be presenting their 49 findings or recommendations for change is that I want to understand what's a no-brainer that we're just going to do because it's really not going to have any resource implications. And what are the things that are going to have resource implications, but potentially are going to address very, very big gaps? Because it's all about return on investment at the end of the day. And so I'm not just going to make changes for the sake of making changes. They have to be changes that meet the objectives of the program and the objectives of the learner and the business. And so it's not it's a holistic view of the landscape. It's not just looking at it from one perspective.
Well, let's talk about that return on investment, actually, because the ultimate return, and if we're speaking about pharmacists in particular, is building the skills necessary within your pharmacists to treat your patients, make sure they're getting the optimal level of service and health advice, right? So let's talk about what that looks like, because we both graduated back in the 90s. Right? It seems like
Long
a
time
while
ago.
ago. and the skill sets for successful pharmacists back in those days, I think, are very, very different from today. In fact, I know they're very different. When I first graduated, basically my entire skill set, or the skill sets that I was supposed to have or required to have, were the ability to read prescriptions, dispense a subscription, do basic counseling, and really not much more was demanded of me, especially early on in my career. Obviously, as you get more into your career, you pick up management skills and other type of clinical skills. But it seems today pharmacists have there's an expectation that pharmacists have a higher level, especially of clinical skills. We talked about pharmacist prescribing, which was only a dream back in the 90s, but now it's a reality. So I want to ask the question about what do you think, first of all, are the key qualities and skills that distinguish a successful pharmacist today? And how do your programs tailor that training, foster those attributes in pharmacists?
Look, there's no doubt that pharmacists need to have a core level of knowledge with respect to medicines, medicine safety, diagnostics, and a whole raft of different things so that they can deliver on the technical aspects of their role. But the soft skills are just as important. So things like problem solving, communication, empathy, and the whole raft of things that are required for true healthcare professionals. And it's hard. It's really, really hard because pharmacists are black and white, and the world is all around shades of grey. Right, and so you need to make sure that you're complying with the regulatory requirements, but you need to do it appropriately and realise that there's a patient at the centre of everything we do. And so, as an example, if I'll sometimes go into a pharmacy and ask for some Ricodine, which is a Schedule 3 item that is subject to abuse. And so a lot of the time, particularly young pharmacists, are a little bit scared to actually just be a pharmacist. Ask the questions, ensure that there's a therapeutic need, ensure that it's appropriate for the patient. And so I often find pharmacists shying away from that and saying, I don't have any, rather than doing the things that they need to do to satisfy themselves that I'm not abusing it, I'm using it because it's a damn good cough suppressant and I've got a dry cough. And so it's really, really hard. And we rely very, very much on the sites to support them to build those soft skills. Now, the universities have pivoted and they're doing a lot more soft skill training in their courses, but there's still a long way to go to ensure that pharmacists actually register with all of those soft skills. As you move on through your profession, I think your knowledge base actually declines, but your soft skills increase, and so your problem solving skills get better. So I think that almost makes you a better pharmacist because you treat people as people and don't think that they're trying to rort the system or get around the system. And so it's about making sure that we deliver patient centered care.
I think it's a great call out. I remember getting back to my university days many, many eons ago, and very much, I don't think it's changed that much until recently, where most of the focus is on the clinical skill set. You need to know what you're talking about when you're speaking to a patient about their medication. And so that is 99% of what you're taught. But those soft skills are really important because I always like to say that pharmacists really are unique in the conditions that they operate in. They operate in a no fail environment, really can't make mistakes. There's time constraints. They only have seconds to make decisions on medications and prescriptions or in front of patients. They're constantly in demand. So it's a difficult thing to juggle. And like you said, a lot of pharmacists, or at least early career pharmacists, will tend to put their hands up and go, oh, I don't have this or I can't do this, rather than take on the challenge. It takes many, many years of kind of understanding how to juggle all that, along with building up the soft skills of talking to people with empathy, listening skills, really understanding their issues in a constrained amount of time. So I think that's critically important. It's great to hear that universities are starting to understand that. Chemist Warehouse obviously understands that and incorporates that as part of their training. I want to kind of ask you, this is all prelude to my next question, which is, what other challenges do you face? I mean, you have extremely busy pharmacies, as we all know. So what other challenges are there, and what do you have to overcome to make sure that your pharmacy staff have those soft skills, have those hard skills, clinical skill sets, and all the things that they need to be well prepared for the demands of a job at Chemist Warehouse? What other kind of things are you, or barriers that you have to maybe overcome, maybe uniquely with Chemist
Mm.
Warehouse, that other brands do not?
I think the challenges are the same, because even in non-chemist warehouse pharmacies, some are very, very busy, some are quiet. And so a quiet pharmacy, you need to think about how you're going to expose people to all aspects of pharmacy. And so that's a challenge. And then when it's busy, it's making sure that you're appropriately resourced so that you can deliver the support and the training on the fly. And that's a juggle. And so what we're trying to do is elevate that role of the preceptor and actually changing the culture so that education is just part of what a pharmacist does, and it always has been. I don't know about you, but I always worked with students. I always worked with interns. I always supported other pharmacy team members, irrespective of what I do. Even in my role now, I mentor and coach my team so that they develop. It's inherently part of what a pharmacist does, but it's also rewarding because you're giving back to the profession that has supported you in your journey. Um, but it's different because people have changed, and unless they see something tangible that they get from doing this, they don't want to do it anymore. It's all too hard, and so it's really building that learning culture. And the reality is, we're always learning. And so, I mean, we're looking at things like mentor programs. And so there's mentor programs even with our new managing partners. And so they are actually buddied up with more experienced owners to support them in their early journey. And so that they're imparting some of the things that worked for them in terms of building the skills and capability of their teams to support them. So they're the types of things that we're doing. But the reality is we're supplementing with things that don't happen at the coalface so that people have got opportunities just in case they're missing out at the coalface. Now, are they mandatory? No, but if someone's proactive and wants to learn, they do. And so, there's a big focus on some of those soft skills in our Leading for the Future program, but we're leveraging off some of the work that we've built out there and putting modules into our pharmacist education program as well. We're looking at what the gaps are and we're trying to fill some of those gaps, because there's no point in me developing programs that don't meet the needs of the learners.
Well, one thing that you may not have realized here on this podcast is I have the ability to grant, very temporarily, magic powers to my guests. So I'm going to grant you magic powers right now with a wand, and you can wave that wand and improve something about your training program instantly. So, what would that be and why?
I would like to clone my team because they're brilliant, but there's just not enough of them.
That is a very clever answer, and you're going to get a lot of cookies and brownies and whatever they give bosses over there tomorrow morning or whenever they hear the podcast. That's very good. I like that. That's your final answer.
That's my final answer. I want the ability to clone.
I love it. I love it. All right, good answer. So let me ask you final question. Looking to the future now, uh, what exciting developments can interns, students, pharmacy assistants, registered pharmacists, what can they anticipate in Chemist Warehouse training programs? What have you got cooking up for the future? I know we talked about a lot of programs you have now and some that you've just started and are just
Yep.
launching. Is there, and you could talk more about one of those, something you're really excited about, or is there something coming up that you can maybe give us a sneak preview of some of a new training program or something that perhaps other brands may not have, considering how innovative the training programs are at Chemist Warehouse?
Well, the three that we're launching early in 2025 are our Step Up program, which is our student pharmacist program. And so we're really proud of that. And that involves a combination of different things. Including a workbook, and so that is something that the student works through with their supervising pharmacist, and everyone will be involved. And it's really about making them comfortable and valuable as a team member. And so when we looked at that particular program, we thought that what students would want is primary healthcare modules. Well, that wasn't the case. What they wanted was a structured approach to learning some of the operational aspects of their role in pharmacy, because a lot of them come into pharmacy and have never worked in a community pharmacy, and they're only as good as the people they work with, or only as good as the training provided by the people that they work with. So this provides a structured approach to upskilling students to free pharmacists up. So the pharmacists can do the more clinical work and the students can do the things that they can add value to. We did still develop some online primary healthcare modules, but there as an aside, that wasn't the core part of the program. The core part is the workbook that they do with their supervising pharmacists. And we're looking at how we actually reward people that go through the program. And it's not a program that's designed to be delivered in a couple of months. It's designed to be delivered over a 6 to 12-month period, because the reality is student pharmacists only work maybe one shift, two shifts a week. And so it's really important that we don't overload them. And what happens is that it actually assists them with what they need to do at uni as well. They become really important commodities, and it sets them up for their future as a pharmacist, because I know my grounding as a student and what I learnt as a student really did springboard me into my career. Um, the new managing partner program and the retail manager program, which the retail management program is a reinvention of something we used to do years ago, but we've reinvented that, and that's a combination of online and face-to-face workshops. The new managing partner program again is webinar based, but there's a mentor, which is an experienced pharmacy owner that's been with the group for a really, really long period of time. And the exciting piece for me is really building out those early career pharmacist pathways. And so if my project in hospital it gets delivered, obviously that's going to be a really, really concentrated effort. How we can take community pharmacists into the hospital landscape and then into specialised hospital roles. And we're working with a combination of different organisations to do that, because I also know that I can't do everything. So it's also important to leverage the training and education that's already out there and supplement that with the things that are lacking. The first pathway that we will build out is the ownership pathway, and so that will take you from early career pharmacist to pharmacy manager to maybe area manager to then ownership, because what we do as a group is we grow our own. And so rather than other banner groups that are out there selling banners, we identify people from within who have proved themselves as an incredible pharmacist, proved themselves as a good manager, that we know are going to make a really, really good managing partner or owner. And then we nurture them through the process. We provide the opportunity and nurture them through the process.
Yeah, and I think a lot of students and interns and young pharmacists would be super excited to hear that, because that pathway to ownership sometimes is just they can't see it, and they're not given the opportunities, and to have a company say, hey, just stick with us and we will nurture you and nurture your profession to wherever you want to go. I think that for a young pharmacist, I think it would be super exciting to hear, and super gratifying as well.
Yeah, and look, and the reality is there are still ownership opportunities. And as a group, I should know this statistic, and I don't know, but I think in the last year or two, we've actually brought on an extra 18 new managing partners, and all of them have actually been nurtured, well, most of which from student to intern to pharmacist to managing partner. And so are the opportunities always going to be in your local suburban environment? No. So if you're willing to move and you're willing to take opportunities as they arise, those opportunities are there. But you have to prove yourself. So it's not something that you're going to be able to do in your first year post registration. You have to grow to that and develop to that.
Absolutely. I think that's fair. It's fair to ask. And I think a lot of young pharmacists would put their hands up and say, I'm ready for the challenge. And so it's just nice to hear of an organization that creates that pathway for those who want to embrace a challenge.
Yep. And look, the reality is that pharmacy is moving into healthcare services as well, more and more every day. And as an organisation, we embrace all of those changes and we deliver on those programs. And so if you're looking to be a more clinical or professional pharmacist, that's got pathways as well. But at the end of the day, one of our core services is around medication dispensing, counselling, and supply. So we still have to do that, but we can reinvent how we do that so that we can free the pharmacist up to actually add more value, doing a UTI consult, doing and prescribing to their full scope. There's some really exciting things happening, and the good thing is, as an organisation, we're embracing all of those things. So if there's something you want to do, and it's financially viable, because that's the other piece. It needs to be sustainable. We will get behind you and help you do that. We've got some pharmacists that are diabetes educators, and so there's a lot of movement in that space as well. But in the career paths programs, I'm looking at making that a lot more structured.
That's fantastic. And I think we can leave it there. Angela, thank you so much for your invaluable insights and impactful work that you're doing at Chemist Warehouse. I think that it sounds exciting, and I hope young pharmacists will be hearing this podcast, and will reach out and ask a little bit about the various pathways that are available to them, whether they be clinical or managerial, or maybe a little bit of both. I think that's, as a young pharmacist, you couldn't really ask for more than that. So I really appreciate you taking the time and talking with us today, and thank you so much.
My pleasure, and thank you for allowing me to talk about something that I'm so passionate about.
Absolutely. Thanks for joining us today on the Pharmacy View podcast. And don't forget to like, share, and leave a comment if you found this episode of value or have any feedback. Podcast episodes are promoted through social media, LinkedIn, YouTube, and major podcast mediums. And each episode can be found on the Pharmacy View webpage with links to guest contact and business details. If you're a pharmacist or industry support supplier and would like to join us on an episode, send us a message through LinkedIn or complete the inquiry form on the Pharmacy View webpage. I'm your host, Michael Alexander, pharmacist and co-founder of the communication intelligence platform Audirie. On behalf of Shopfront Solutions and Arion Technologies, thanks again for joining us today on the Pharmacy View podcast.